One of the big reasons that I suggest perineal massage during pregnancy is because I suggest so many postpartum women use it. So getting used to it before is so much easier to slide back into it after. What I would suggest is as soon as you are ready, look at it. Get out a mirror and look at the area. And I understand some people will take longer to be ready than others, but it is important to see it because then you can understand what's going on and you can visualize things a little bit better. The next thing I would suggest is as soon as you're ready, start touching the area. So no matter what degree of tear you have, I say start touching the area. And when I say the area, I don't mean right over where maybe your tearing has been or your episiotomy or where you have stitches. I mean around it. So I'm just gonna show you what the perineum is. Most often women will tear down and around this area. Of course, there can be times where you tear in different areas, but what I would start with is look and kind of be familiar with where your tear is. Next, I would start touching. Let's say that your tear is straight down here. Maybe you start by touching like in and around the area. Stay away from the part that's healing, but touch around. Touch your clitoris, touch your labia, touch around the area, staying away from the most vulnerable area to start with. Obviously, I highly suggest washing your hands before you do that. As far as progressing to getting onto the area of injury, I would suggest waiting for your care provider, your midwife, your obstetrician to take a look and be able to ask them to take a look and give you guidance, because everybody's situation is so different and it's hard for me to say you should all start at this time. But when you're ready, start touching around, or when they suggest and when it's all healed, start touching around the area and then you can start massaging the area. I understand that having new babies does not really lend to a bunch of extra time on your hand. So I'm not saying that everyone needs to go do this every day for 20 minutes or anything. But you'll notice some of you after the healing phase, you're out of the initial healing phase, like after that 6 to 8 weeks or whatever, you might start to notice areas of tension or pressure, or maybe when you go to have sex, it feels like something's tight. That's what perineal massage can be really good for. After a while, you can start being a little bit more quote unquote aggressive with the tissues. I don't mean aggressive, but able to get onto the area specifically and do some massage to the area. I'm a huge fan of using your breath when doing this because the breath will help to calm down the muscle. So I have suggested to people that they come onto the area and really use their breath, both inhale and exhale, to picture the relaxation. Scar tissue in the perineum can create pelvic floor muscle that's not as dynamic and not as shock absorbing. So that would be the biggest reason to, from the beginning, kind of work towards recovery and healing of the muscle so that it doesn't hold you back.